Right. So, a very good evening, and I welcome you all to this particular YouTube session. So, as a part of the continuation of a series of the FMGE high yield topics, so today I will be discussing the image-based questions on the nephrology. So, yesterday and day before yesterday also we have discussed the image-based questions on nephrology. So, as a continuation of the high yield topic discussion for FMGE, today also let me take up the discussion of the image based questions, but today it will be exclusively on nephrology. All right. Yes, Sandeep, Soni, Shreya, right? Good evening, everyone. Right. Let us start with the first question. Right. So I'm myself, Dr. Rajesh Gubba. I'm the general medicine educator on Unacademy platform. Now let me start the first question related to your nephrology. Okay. So the first question is, stenosis of the artery which is shown in your box is not seen in atherosclerosis, Takayasu arteritis, fibromuscular dysplasia. Yes, Avinash. Good evening, Avinash. Please answer this question, Avinash. Stenosis of the artery is not seen in. Right. So whatever is being represented here, it is your renal artery stenosis. Okay. Very good, Avinash. So you will not have the renal artery stenosis in case of the polyarteritis nodosa. Right. Very good. Now, what is polyarteritis nodosa? It is the medium vessel vasculitis. Right. This is the medium vessel vasculitis. Can anyone tell me what will be the neurological manifestation of polyarteritis nodosa? Yes, any one of you? What is the neurological manifestation of the polyarteritis nodosa? Whereas you take in all the other conditions like atherosclerosis, Takayasu arteritis, fibromuscular dysplasia, in all these you will have the renal artery stenosis. Right, very good, Avinash. Yes, Avinash, tell me what will be the neurological manifestations of polyarteritis nodosa? Right. So the neurological manifestations of the polyarteritis nodosa, it includes mononeuritis multiplex. Right? It can be anything. Right? Mononeuritis multiplex. Any of this particular an individual nerve in multiple areas, it can get paralyzed or it can get affected. That is what is called mononeuritis multiplex. Okay. Yes, Mahesh Sani, good evening. Okay. Now you see, these are all the causes for renal artery stenosis, as Avinash was telling. So in elderly individuals, the most common cause for renal artery stenosis is atherosclerosis. And in young individuals, you take in India, the most common cause is the aortic arteritis. So aortic arteritis, it is nothing but your Takayasu arteritis. Right? And in Western countries, the most common cause for the renal artery stenosis is the fibromuscular dysplasia. Right? So this is a very important slide to tell you what is the cause for the renal artery stenosis. Okay. Now the next important thing is what will be the clinical presentation of this renal artery stenosis. So in these patients with the renal artery stenosis, there will be activation of RAS, renin-angiotensin-aldosterone system. So they present with hypertension, and most of the times the renal artery stenosis, it is bilateral. Right, most of the times the renal artery stenosis is bilateral, and when you auscultate the abdomen, right, what is that you will listen? You will listen a bruit. Right, when you auscultate the abdomen, you will listen a bruit in the abdomen or the flanks. That is what is the presentation in case of the renal artery stenosis. Now, followed by that, the renal artery stenosis, you should know what is the screening test for renal artery stenosis and what is the investigation of choice for renal artery stenosis. The screening procedure is by gadolinium enhanced 3-dimensional MR angiography, right? Three-dimensional MR angiography. Okay, so that is a screening procedure of choice. That is a screening procedure of choice. But what is a confirmatory test? Right? What is a confirmatory test for your renal artery stenosis? The confirmatory test for renal artery stenosis, it includes contrast enhanced arteriography. So contrast enhanced arteriography, it is the confirmatory test for your renal artery stenosis. Okay, so and how do you treat this renal artery stenosis? Remember, if it is a unilateral renal artery stenosis, right? If it is a unilateral renal artery stenosis, you can give AC inhibitors for the treatment of hypertension. But if it is a bilateral renal artery stenosis, remember the AC inhibitors, right? The AC inhibitors, they are contraindicated. Right, the AC inhibitors, they are contraindicated if there is bilateral renal artery stenosis. Yes, Shubham Garg, yeah, I have a Telegram group that is called Medicine Made Easy by Dr. Rajesh Gubba. So you can join that particular channel, and wherein you can have the discussion of the medicine related questions. Okay, so in bilateral renal artery stenosis, then how do you treat hypertension? So you need to give calcium channel blockers. Right, you need to give calcium channel blockers. Next, in refractory cases, what will you do? Right, in refractory cases, the treatment for the renal artery stenosis, it includes the PTRA. So what is this PTRA? This PTRA, it stands for percutaneous transluminal renal angioplasty. This is in case of refractory cases. And not only that, renal artery stenosis, right, renal artery stenosis, it is also the one which will cause recurrent flash pulmonary edema. Right, recurrent flash pulmonary edema. Okay, so that is about the treatment of the renal artery stenosis in refractory cases. Right, in refractory cases. Okay, so that is about the question on the renal artery stenosis. Right, next, and always remember 50% of cases of renal artery stenosis, it will be bilateral. Now we will take up the next image based question in the nephrology. Urine sample of a patient shown in the photograph is most likely minimal change disease, chronic renal failure, IgA nephropathy, nephritic syndrome. Urine sample of a patient shown in the photograph is most likely. Yes. So let me see who will be the first person to answer this question. No. It is not nephritic syndrome. See, what does this patient has? This patient has a gross hematuria. Right, this patient has a gross hematuria. Now among the options given to you, right, where is that you will have a gross hematuria is in patients with the IgA nephropathy. Right, in all the types of your nephritic syndrome, you will not have the gross hematuria, but in IgA nephropathy definitely you will see the gross hematuria. So the answer here is IgA nephropathy, but not the nephritic syndrome. So this is a very common mistake which is being done by most of the students. Seeing the hematuria, they will directly jump onto that particular nephritic syndrome. So please, if you have any other option causing gross hematuria, go with that, because IgA nephropathy is the one which is the condition which will cause gross hematuria, which is nothing but your Berger's disease. Very good, Deepan. So this is also called Berger's disease. Okay, now let me show you all the conditions which will cause gross hematuria. Now if you see all the conditions which will cause the gross hematuria, these are all the causes. Number one, IgA nephropathy, which is nothing but your Berger's disease. Then Alport syndrome, right, which is a congenital disorder. Then thin glomerular basement membrane disease, hypercalciuria, urolithiasis. These are all the important causes of recurrent gross hematuria, right? So please don't make a mistake by saying that the answer is nephritic syndrome. So I can see most of the students initially they were answering it as nephritic syndrome, right? It is not nephritic syndrome where you will have gross hematuria. And you take this minimal change disease. Minimal change disease, what do they present with? They present with edema, right? They present with edema. And minimal change disease is the one the patient will have the nephrotic syndrome, and this is commonly seen in children. Okay, right. Right. See, yes, Avinash, the presentation of IgA nephropathy itself is in the form of gross hematuria. Whether it would be secondary to upper respiratory tract infection or whatever it is, the presentation itself will be in the form of gross hematuria. But you take nephritic syndrome, right? You have many forms of nephritic syndrome. All the forms of nephritic syndrome, they do present with hematuria, but not with gross hematuria. So that is the reason why the answer is your IgA nephropathy, right? Next. And in chronic renal failure, there need not be gross hematuria at all. Now, we will move on to the next question. Yeah. Glomerulopathy seen in the disease, the organism is shown in the photograph. Right? The organism is shown in the photograph. Diffuse glomerulosclerosis, membranous glomerulopathy, mesangial-proliferative glomerulopathy, focal segmental glomerulosclerosis. So first of all, what is the organism? First of all, can anyone tell me what is the organism there? Yes, Karki, you please answer in the options given to you. Right. So first, what is the organism? This is your HIV. Right, HIV. So now tell me, in HIV, what is the type of glomerulopathy you will see? What is the type of glomerulopathy you will see in HIV? So the type of the glomerulopathy you see in HIV is very good, Deepan. That is your focal segmental glomerulosclerosis. So this is the most common form of the glomerulopathy that you will see in case of the human immunodeficiency virus. So this focal segmental glomerulosclerosis, this is also called reflux nephropathy. Right? It is also called reflux nephropathy. And focal segmental glomerulosclerosis, the presentation will be in the form of nephrotic syndrome. Right? Presentation will be in the form of nephrotic syndrome. Now, what I wanted to tell you in HIV is that in case of HIV, it is not just only focal segmental glomerulosclerosis, right? And you have the other forms of glomerulopathies also. What are the other forms? See, the most common one is the focal segmental glomerulosclerosis. Okay, you can also call it as collapsing glomerulopathy. Right, and the other forms are the acute diffuse proliferative glomerulonephritis, mesangial-proliferative glomerulonephritis, right, and membranoproliferative glomerulonephritis and membranous glomerulonephritis. Okay, so these are the other forms of the glomerulopathies in HIV. But what is the most common one? The most common one is your focal segmental glomerulosclerosis. So please remember this. This is a very, very important point, right? Next, we will move on to the next question. Yeah, method, right? What is that method? That is what is given in your photograph. So method can be done for long periods from same site, right? Method or the procedure can be done for long periods from same site as AV fistula reduce bacterial contamination of the site. AV fistula causes arterialization of the vein. AV fistula reduce the chances of graft failure. AV fistula permit small bore needle for high flow rate. Right. So the purpose of placing the AV fistula is it is to mainly cause the arterialization of the vein, because the dialysis ports, where do you place? You will place in the vein. Now from the dialysis, that high flow whichever is coming from the dialysis, in order to see that if the vein has to tolerate that particular high flow, the vein has to get arterialized. So for which we connect the artery with the for which we connect the artery with the vein. So that will cause the arterialization of the vein, right? That will cause the arterialization of the vein. So, and you should know what is the name of this fistula. Can anyone tell me what is the name of the fistula? Any one of you? What is the name of this fistula? Yes, what is the name of this fistula? Very good, Sandeep Gade. So the name of the fistula, it is called as Seminobraccia fistula. So this name is called Seminobraccia fistula because it is in the honor of the Italian doctor, right? Because it is in the honor of the Italian doctor. So what will happen by placing the fistula? There will be arterialization of the vein. So this particular fistula, it is connected between the radial artery, right? It is connected between the radial artery and as well as the cephalic vein, right? Between the radial artery and as well as the cephalic vein. Okay, so that is what is your Seminobraccia fistula, right? And the chances of thrombophlebitis also can be decreased. Now, what is the principle of your hemodialysis? This is another important question that will be asked. The principle of the hemodialysis is countercurrent mechanism, and the other important principle is the facilitated diffusion. So please remember these two words for the principle of the dialysis. Next, if the question is asked what is the most common complication of dialysis, it is your hypotension. Why hypotension is most common? Because large quantity of the fluid, right? Because large quantity of the fluid is taken out by the body and it is sent into the dialyzer, right? It is sent into the dialyzer. So that is the reason why this individual can develop what is called hypotension. And most common complication of recurrent hemodialysis, that is your accelerated atherosclerosis. That is your accelerated atherosclerosis. Okay, so these are few points about the hemodialysis. So the purpose of keeping this particular AV fistula is to mainly to cause arterialization of the vein, and this particular fistula is connected between the radial artery and as well as the cephalic vein, and the chances of thrombophlebitis will be decreased. The name of the fistula is Seminobraccia fistula. The principle of dialysis is countercurrent mechanism and facilitated diffusion. And most common complication of dialysis is hypotension, right? And most common complication of recurrent hemodialysis is accelerated atherosclerosis. Okay, right. Yeah. What is the true statement about the struvite type of stones shown here? Present in alkaline medium, most common kidney disease, composed of calcium pyrophosphate stone, most common kidney stones. What is the true statement? Right, so this is another very important image based question in your nephrology, that is renal calculi. What is another name of these particular struvite stones? Oh, is it composed of calcium pyrophosphate? Yes, Aniket Saha and Soni. Right. So very good, Babu Chandran. So Babu Chandran has given a correct explanation, and Avinash also answered this question correctly. So they are present in the alkaline urine, and the organism responsible is the proteus. The organism responsible is proteus. And what is the another name of this particular steroid stones? This is also called Staghorn calculi. Very good, Avinash. Right, this is also called the Staghorn calculi. Okay, and what is this composed of? This is not composed of your calcium pyrophosphate stones, right? It is composed of MAP. What is MAP? MAP is nothing but magnesium ammonium phosphate stones. They are nothing but your triple phosphate stones. They are nothing but your triple phosphate stones. And where are they formed? They are formed in the alkaline nature of the urine. And what is the organism responsible? It is your Proteus mirabilis, right? Proteus mirabilis. So this Proteus mirabilis is the one which will cause the precipitation of, right, which will cause the precipitation of magnesium ammonium phosphate stone, right, which will cause the precipitation of magnesium ammonium phosphate stones. Okay. Next, now what does the urine examination show? Right, it will show the coffin lid appearance, and if the size is big, that will give you steroid stone appearance or the Staghorn calculus appearance. Right, urine examination show coffin lid appearance, but if the stone is very large, right, you will have this steroid stone or the Staghorn calculus appearance. Okay, now as the Proteus mirabilis is the one which is responsible for your triple phosphate stones, what you have to do, you have to give antibiotic or the irrigation, right, irrigation of the kidney parenchyma with acetohydroxamic acid, right, with acetohydroxamic acid. Okay, so that is how you have to treat this particular the triple phosphate stones. So to shortly revise the triple phosphate stones, remember the various names given to this steroid type of stones are, they are also called Staghorn calculi. They are also called triple phosphate stones. And what is it composed of? Magnesium ammonium phosphate. And they are formed in the alkaline urine or alkaline medium. The organism responsible is the Proteus. So Proteus is the one which will cause the precipitation of MAP stones. And urine examination, you will have coffin lid appearance. Now because the Proteus mirabilis is the one which is responsible organism, what is the treatment you will give? Antibiotic or the irrigation of the kidney parenchyma with acetohydroxamic acid. That is the one like how you have to treat this particular triple phosphate stones or steroid stones or Staghorn calculi. Okay, right. Now we will move on to the next question. Yeah, acute failure of the organ shown in the photograph results in hyperkalemic alkalosis, hypokalemic alkalosis, hyperkalemic acidosis, hypokalemic acidosis. Acute failure of the organ shown in the photograph results in. So what is the image shown to you? It is definitely the kidney, right? So you can give ampicillin, Avinash. Right, so it is the one which causes hyperkalemic acidosis. Hyperkalemic acidosis. So in acute renal failure, what happens? There will be decreased GFR. So once there is decreased GFR, what will happen to the potassium levels? The potassium levels will be increased. And not only that, in case of the in case of acute renal failure, there will be impairment of bicarbonate reabsorption. Right, there will be impairment of bicarbonate reabsorption. So because of impairment of bicarbonate reabsorption from the proximal convoluted tubule, that will make the individual to develop what is called acidosis. Okay, so the answer here is C, hyperkalemic acidosis. Right, so some of you are answering hypokalemic, some of you are answering various options, but remember acute failure of the organ shows hyperkalemic acidosis, right? It is not your hypokalemic acidosis, it is hyperkalemic acidosis, right? Next. Yeah, the cast shown in the photograph are usually found in, right? So this is your cast. Sorry. Acute tubular necrosis, interstitial nephritis, nephritic syndrome, nephrotic syndrome. So first of all, you should know what caste is this. So this is your RBC caste, right? So where do you have this particular RBC caste? RBC caste formation will occur in the nephritic syndrome, right? It's a straight question. There is no difficulty in this question at all. Okay, right? That is in case of nephritic syndrome. Yeah. You see the last question. Chronic use of the method in patients of end-stage renal disease is usually done once per week, twice per week, thrice per week, daily. Acute tubular necrosis will not show any particular caste. Right? Acute tubular necrosis will not show any caste. Acute tubular necrosis will lead to acute renal failure, and in acute renal failure you don't have any caste formation. Right. So chronic use of method in patient of end-stage renal disease is usually done. So what is this being done? This is your dialysis. So how frequently dialysis is done in patients with chronic renal failure? It is thrice per week. It is not twice per week, Avinash. It is thrice per week. Right. So thrice per week is being done in case of the end-stage renal disease. So end-stage renal disease, it comes under your chronic renal failure or chronic kidney CKD stage 5. Okay, so CKD stage 5, we classify this into two types. We have what is called CKD stage 5D, CKD stage 5T. So CKD stage 5D is that the patient is on dialysis. CKD stage 5T is that the patient undergoing transplantation. Right, undergoing transplantation. Okay, right. So that is what is your 5D and as well as 5T. Okay, and these patients with chronic renal failure, they have to undergo dialysis, right, thrice per week but not twice per week. So these are some of the questions on the nephrology. So let me shortly revise all the questions whichever I have discussed. So the first question was on the renal artery stenosis, right? The most common cause for renal artery stenosis in elderly individual is atherosclerosis, whereas in India, the most common cause in young individuals is Takayasu arteritis, and in Western countries, in young individuals, the most common cause for renal artery stenosis is fibromuscular dysplasia. And remember, renal artery stenosis is not seen in case of polyarteritis nodosa. Now, the next question is on the gross hematuria. So the urine sample of a patient shown in the photograph is most likely seen in case of IgA nephropathy. So what is that shown in the image? Shown presence of gross hematuria. Okay, so these are all the various important causes of the gross hematuria. IgA nephropathy, Alport syndrome, thin glomerular basement membrane disease, hypercalciuria, and urolithiasis. Right, and the next question is on the HIV causing glomerulopathy. So the most common form of glomerulopathy caused by HIV is focal segmental glomerulosclerosis. Right, the most common form of glomerulopathy seen in HIV is your focal segmental glomerulosclerosis. Next, now the method that is the presence of the fistula. So what is the purpose of placing this particular fistula? It is due to arterialization of the vein, and the name of the fistula is Simonobrecia fistula. Right, and the next one is the struve stones. So struve stones, they are also called triple phosphate stones, right? And where do you see this particular struve stones? That is in the alkaline medium. And what is the organism? That is Proteus mirabilis. Next, acute renal failure of the kidney, acute kidney injury. What is the electrolyte abnormality you will have is hyperkalemic acidosis is the electrolyte abnormality what you will see in case of the kidney, right? And the image which is shown to you is the presence of RBC cast, right? So in RBC cast is present in case of nephritic syndrome, right? RBC cast is present in nephritic syndrome. Next, lastly, dialysis in patients with chronic kidney disease has to be done thrice per week, right? So these are the images on the nephrology. So, and now 11 p.m. today we have image based session on Unacademy Learning app, right? So on Unacademy Learning app we have 11 p.m. image based questions, and these image based questions will be on endocrinology, right? These image based questions will be on endocrinology. So this is a special class which is a free session, so please attend this session and try to utilize the session and crack your FMGE exam in this particular attempt, right? So thank you very much and see you again all in the upcoming sessions. Yes, Mahesh Saini, I did not understand your question. Sir, lower limb bandage start, ankle popliteal mid thigh. Sir, कहाँ से start करते हैं? No, what is your question? I did not understand your question. Okay, so you can post me on my Telegram channel, right, with a proper detailed explanation of your doubt. I will definitely answer your question. Okay, so thank you very much.